All right. Welcome. Kelsey, would you like us to get started?
Sure. Welcome, everybody. Welcome to our Doctor of Education virtual session. Thanks for joining us as we explore the Doctor of Doctor of Education program here at Nebraska Methodist College. We're excited to share some of this valuable information with you. I'm Kelsey Abalafia. I am the Director of Enrollment Services here, and I'll be your moderator for this session. As our panelists are signing in, I think they are all signed in actually. Let me go ahead and introduce them. So we have Dr. Whitney Robertson. She's our Program Director of our EDD program here. Dr. Robertson serves as our Program Director for the MBA in Healthcare and the Bachelor of Science in Healthcare Management, as well as the Doctor of Education program. She's also a faculty member and teaching a range of healthcare business courses. She holds an MBA in Strategic Management of Life Sciences, a PhD in Cellular and Molecular Biology, and has worked in healthcare administration and consulting. We also have Dr. Carrie Wade, who is a professor. Dr. Wade is a professor of doctoral studies at NMC. She serves as the coordinator of the EDD program, leadership track, and also of the doctoral scholarly project for doctoral students. She has been with NMC for 10 years and was one of the original founders of the EDD program at the college. Dr. Wade is a past president of the Nebraska Nurses Association and continues to hold leadership roles for the organization at the state level. We also have Kathy Filipowicz. I mispronounced. I apologize, Kathy. Kathy is here with us. She is our recruitment and admissions coordinator for this program. And we also have Michelle Olson with us. She is the associate director of enrollment. So here's what you can expect during the next hour. Dr. Robertson and Dr. Wade will discuss the format and structure of our EDD program, highlighting key features, addressing some frequently asked questions for you all. And then Kathy and Michelle will then guide you through the admissions process and outline our financial aid opportunities. Before we dive in, just a few housekeeping notes. Today's session is being recorded. Participants will remain in listen-only mode. We encourage you to engage by submitting questions for our Q&A portion at the end. You can find the Q&A or chat feature at the top or bottom of your screen. Feel free to submit your questions at any time. We'll address them after the presentation. We'll get started shortly, probably right now, actually. Thank you again for being here. Dr. Wade and Dr. Robertson, if you want to take it from here.
Actually, I'm going to go ahead and start. Thank you all so much for joining us today. We're excited to have you. Our EDD program is amazing with our amazing faculty, Dr. Wade and Dr. Robertson. And just a little bit of fun facts about Nebraska Methodist College. So we are a not-for-profit college focused primarily on health education. 100% of our faculty are leaders in their fields. We're small but mighty. We have 1,000 plus students, and that is on campus and online. And we actually offer certificates all the way up to doctoral programs. And we are affiliated with the Methodist Health System, which is one of the largest health systems in the state of Nebraska. And this map is, I love this map because I get to meet students from all over the country. Although our EDD students are online, they do come to campus. And so it's always exciting to get to meet people. And this kind of shows where our current students are from. We've had them from other states that aren't listed on here, but this is what we currently have with our student population.
Well, I will share some information about the highlights of our EDD program. Unlike traditional PhD programs, our EDD program is focused on practice, and therefore, at the conclusion or towards the tail end of your program, we conduct a scholarly doctoral project rather than a dissertation. And so this is actually translational research where students are identifying an issue and implementing some sort of change or policy related to that issue based on the research that's already been done or the professional guidelines regarding that particular issue. So it's a very practice-focused doctoral scholarly project rather than the heavy research focus. For our EDD program, students can attend full-time or part-time. It's your choice. The program really was designed for working adults, and so the majority of our students do complete the program as a full-time student. However, is okay if you would like to do a part-time plan of study. And you can switch midway through. I would recommend, though, if you're unsure and kind of making the decision if you want to go full-time or part-time, it is easier to start at full-time than switch to part-time later if needed, simply because our classes, many of them are offered only once a year, and that way you don't have to wait a whole nother year if you decide you wanted to go full-time instead. Our degree can be completed in 24 months if you are a full-time student. We have start dates both in the fall and in the spring, so in August and again in January. Our program allows graduates to work in academic and healthcare settings, community settings. Those really are our three focus areas: academics, healthcare, and community. And our curriculum is focused on those areas as far as the content you'll be learning. We do have a flexible online format. Most of our learning occurs asynchronously, which means you can complete it on your own each week. We do have some synchronous classes that occur in the evenings, and that usually occurs a few times per course. And that would be disclosed to you at the start of the course so you know what days that particular class meets. And then students do come to campus to participate in two-day intensives on campus. The first one is related to orientation, and the second one is related to an actual course that you're taking, as well as helping jumpstart your scholarly doctoral project. So we have two tracks in our EDD program, and first I'm going to talk about the education and leadership in healthcare track. This track creates expertise in transforming organizational culture and creating change as within an organization. Really, the focus on the leadership and healthcare track is on systems. And so within a system, as it indicates here, you learn about organizational culture, organizational change, organizational sustainability, and really building up yourself as a leader within an organization and within a system. This would be an appropriate track for both healthcare and educational leaders and even community leaders as you look to advancing your degree. Um, Students come from a variety of backgrounds into this particular track. Some of them are in higher education and already, looking to advance their degree or their degree for academic rank requirements. We also do have organization leaders from healthcare disciplines, from a variety of healthcare disciplines. In fact, you name the healthcare discipline, whether it's respiratory therapy, nursing, physicians, PA, PT, OT, go on and on. We have healthcare professionals from all sorts of different backgrounds and disciplines. And so that really creates a wealth of knowledge within the courses because you're getting perspectives from a variety of healthcare backgrounds.
So I would like to talk about our second track for the EDD program, which is the newer track, and in response to a lot of student interest in public health policy. So the underlying question that is being addressed through the curriculum in this track is what can be done at the community level to bring about change to improve health for a population or a community, keeping in mind the disparities that exist in that community and promoting equity. So give an example. We recently had a student graduate from this track in the program who was very interested in examining the significant disparity that exists for Black moms, who, the evidence shows, face much more significant rates of morbidity and mortality. So through their scholarly doctoral project and their coursework in the public health policy, and I think you can go back a slide, this student was very much interested in applying the content to look at the evidence to come up with innovative changes or interventions that could be used to educate Black moms to result in gains in advocacy and awareness and empowerment to combat those disparities in those maternal health outcomes. So there we go. The public health policy track is very much appropriate for those who want to build up their leadership skills to advocate for change, whether it's through initiatives or policies or programming that is going to result in the betterment of health for communities and populations. It's appropriate for anybody who's interested in public health at the organization or the community or the broader level. The specific curriculum in this track walks students through developing policies, undergoing needs assessments, examining the research and the evidence on developing those best practices for bringing about change in public health, always focusing on the disparities that exist and with an eye to promoting equity. So we can go forward. All right. The format of the program, now this may seem a bit unique, but we're extremely proud of this feature, which is that our courses are primarily 10 weeks in length. There is one course that is 5 weeks in length. That one is the first course of your 4-course doctoral scholarly project series. And there are 2 courses that are 15 weeks in length, which are also related to the doctoral scholarly project series. All the other courses in the curriculum are 10 weeks. But they're not 10 weeks straight through. They are in 5-week blocks. So in the fall and the spring semesters, those are 17-week semesters. So that means each of those 2 terms has 3 5-week blocks in it, 5 weeks of a course with a 1-week break, and then you come back refreshed, recharged after that 1-week break, ready to take the second block of 5 weeks for that 10-week course. Now, because of the length of the fall and the spring semesters, that middle 5-week block then has the potential for you to start a second course. You could be winding down that first course that lasts 10 weeks, but then starting the second course and would be going through the first 5 weeks of that second course. In the summer, it is a bit different simply because our academic calendar has our summer semester being shorter at 11 weeks. So we are only able to fit two of those 5-week blocks into that summer semester. So if you were to take 2 courses in the summer, they would overlap entirely. And depending on whether you are a part-time or a full-time student, this might mean that you would have 1, 2, or in some cases 3 courses running, depending on which of the 5-week blocks is happening at that point in time in the semester. But the reason we're proud about the format of our courses is because, as we always say, you can do anything for 5 weeks. You can power through anything for 5 weeks. It might seem daunting at first, but by the time you get to that 5th week, you're going to go, oh gosh, that went by quickly, and now I have a break coming up. And during that break, there is nothing scheduled. We have no expectations for you to continue on with reading, or we want you to recharge. Faculty are happy to still chat with you, meet with you, and discuss anything that you would like, but that is your sacred time to recharge and get ready for the next 5 weeks of the course. The second bullet point there. So the nature of the program is inherently interdisciplinary. If we look at the students coming into the program, as Dr. Wade indicated, students are coming from a wide range of backgrounds. Higher ed is certainly represented, and we have students coming from healthcare, actually, providing patient care, as well as public policy and not-for-profit work. So the interaction that you will gain from your discussion boards or some group work or just networking and talking and being at the intensives or at synchronous sessions with other students will be highly interdisciplinary because people are bringing their own different perspectives into the program. There are also courses that are labeled IDS. You will be taking a number of courses with that prefix IDS, which stands for Interdisciplinary Studies. And that indicates that the course is open not only to students in your program, the EDD program, but also to students in the Doctor of Nursing Practice program, DNP, and in some cases, the MBA, Master of Business Administration. So that further increases the mix and the type of interaction, interdisciplinary action that will be brought into those courses. As Dr. Wade mentioned, most courses, I think probably all courses, it's safe to say, in this program do have at least one, if not more, synchronous learning opportunities. The first week of the course, usually the first day or two of the course, there will be often a kickoff session where the schedule for all of these synchronous learning opportunities is sent out well in advance so that you can plan your calendar around when these opportunities exist. And for that kickoff session for each course, you are welcome to log on. And in fact, attendance is strongly encouraged, but we do not require it. We do record it and post the recording so that you can see it if you miss it, or even if you just want to go back and catch up on what was discussed, which is often an overview of the course, the outcomes, what are the expectations, a walkthrough of the syllabus, and how to navigate the course. It's also another great opportunity to interact with your faculty and your fellow classmates. We want to be sure that even in an online program, you feel as connected as possible, which is why we do provide a fair number of these synchronous learning opportunities for you to get online, know that your fellow classmates are all sitting in their whatever environments, logging on at the same time to engage in the course alongside with you. And then we had mentioned the two-day intensives where, yes, you get to come to Omaha, you get to see our lovely Nebraska Methodist College campus. The EDD 700 course refers to your orientation. So if you start in August, then you will be coming to Omaha in August. And if you start in January, then you get to be here in the dead of winter, but you will enjoy it because our orientation is designed to get you pumped up and ready to be successful from day one of the program starting. We have a huge number of people and departments come through orientation to introduce themselves and share how they are there to support you. Technology, the library, the writing coach, the statistician, so many different resources, and we're all very energetic and enthusiastic that you are embarking on your doctoral studies here with us, and we are excited to welcome you to the campus. The other intensive will be in the middle of summer. It is typically the third Sunday/Monday. It's a 2-day intensive of July, and that is for the EDD 832 population health course. So an opportunity for students to come in. There are student-led presentations that are the deliverables for that course that are given for that intensive. And again, we have a variety of speakers attend that intensive who are there to provide their insights and expertise related to population health.
Thank you, Dr. Robertson. That was great. So a little bit about the admissions criteria. All applicants are required to have a master's degree, and you have to have a GPA of 3.0 or above. We do require an admissions essay, which consists of 2 questions, and then a potential interview. So the application is reviewed by Dr. Robertson, and then they will make a decision if they will interview. We do require non-Nebraska residents to meet the state authorization regulations. And then there is an English language proficiency requirement. The application process is very simple, very straightforward. All you need to do is apply online. It is a free one-page application. Like I mentioned, the written statement consists of 2 questions. We do require a resume or CV, and then we do get your transcripts from your graduating institutions. So your bachelor's and your master's, we do require. And then qualified applications will be invited to a phone interview. And then all of your application materials, if you could submit them all directly to the admissions email box. And I know I send that out with my written materials, so no need to write that down, but that's kind of the process. And then they will, the admissions front office will compile everything and get it to me, and then we will move forward. So we do have several deadlines. I just want you all to know that we have a spring and a fall start. So that's why I have both listed. So our standard deadline for spring of 2025, which is coming up so fast, is December 6th. So go ahead and you can get that application started. If you have any questions, we would love to get those in earlier. We have dates set already for the interviews. We have been interviewing for, gosh, at least a month now. So you're not too late, but definitely get your application in. And then those applications will be reviewed on a rolling basis until the cohort's full. And then as you see, we have students who already have applied for the fall, and there is a priority deadline of January 31st with that and a standard of July 11th. So a little bit about the tuition and costs. There are some fees, of course, associated with the program, but the tuition is very reasonable. It's $8.50 per credit hour, and you do have 44 total credits. There is an enrollment deposit, but that is credited towards your first semester's bill. So when you decide that you want to join us, you put down a $150 deposit, we hold your seat, and then you'll get that credit. And then all students do have to have an ID badge. And then the few fees, the technology fees differ from fall and spring and summer. There is a background check fee. All of our students do have to have a background check and a compliance tracking. So financial aid, it's always a big question. I always encourage my EDD students to reach out to their employers. They might be surprised as if they offer assistance, but financial aid is a good resource. You do not have to fill out a FAFSA if you do not want to try to use financial aid, but I do encourage you to do that just in case. It's always good to have it on hand. That will open up in December of this year for 25-26. And then there's a organization called Education Quest. That's always an excellent resource to research external scholarships. Along with our website, you can always check on that too and see if there's anything updated. And then I myself, if I hear of anything, I will send it out to my accepted students also. So commonly asked questions. I'm going to let Michelle take over here, and she's going to ask you some questions to the Dr. Robertson and Dr. Wade. And then if anybody has any additional questions, just put them in the chat box and we would be happy to answer them.
All right. All right. If someone is working full time, would you be able to complete a program like this?
Yes, so as I indicated earlier, this program was designed for full-time working adults. And so the majority of our students do work full-time while they complete the program. The way that we designed it to accommodate the full-time working adult is that on the very first day of class, that entire course is open. So as Dr. Robertson indicated, the course is 10 weeks in length for the majority of our courses. So on that very first day when class starts, you can see the entire 10 weeks of class and know exactly when assignments are due, what types of assignments are due. So you can plan your life accordingly based on that. We do have just one assignment due per week in a class so that you can plan and work on it anytime during the week. And then that assignment is typically due on Saturday, unless it's a discussion board that does require some back and forth. And then we do an initial post by Thursday with reply posts due by Saturday. So the assignments are very well planned out ahead of time. You know, if on Sunday night you want to look, what do I have coming up next week? You can see what assignment you have due by the end of the week and plan out your time, set it aside so that you can spend time focused on working that assignment around your busy life and your families and your work or whatever else you have going on in your life. So yes, it is very conducive for full-time working adults to complete this program.
All right. Um, will you be able to transfer credits?
Yes, we will. Per our policy, we are able to accept up to 12 transfer credits. So as soon as you decide that we are the right program for you and you accept our offer and make a deposit, then you will get assigned to our outstanding academic advisor who will reach out to you and say, do you have any graduate credits that you would like us to consider transferring into your EDD? And we have a online way for you to submit those courses. They would come to me for review. And again, our maximum is 12 credits, but that corresponds to 4 courses, and you can do the math regarding how much of a cost savings that might be. Now, we do have a couple limits in terms of how many years ago we are able to look back and accept your potential transfer credit. And also, it depends a bit on the topic of the course. So for example, where we are, you might not love statistics. That's a fairly common class for people to not love. And you might say, I've already taken a graduate level class in statistics, and I took it 6 years ago. And unfortunately, per our policy, we only are able to take a statistics credit from 5 years ago or fewer because of the scholarly doctoral project and the statistical analysis involved in that course, as well as in some other courses. We do need for you to be a bit more current and fresh in your knowledge. That's just one example, but we are always very happy to look at any potential courses that you would like to send our way and evaluate them for transferability.
Thank you. All right. Can you tell us the careers that they can start with this program?
So as I indicated earlier, the types of careers that people are in who come into this program are typically professionals who work in higher education already, or maybe they work in a health discipline, as I listed several earlier. So they come to us because they want to learn how to be educators or leaders within their field. And, you know, when we're practicing in our specific disciplines, for example, my practice background is nursing. And so, but I didn't ever have an education. It's part of my nursing curriculum of how to be an educator in higher education or with the leadership and management type courses. And so they come to us to gain that additional skill set on top of their practice. And as I said, we get uh, professionals from all kinds of healthcare disciplines. One common question that we get when students apply or applicants reach out to us is, will I be at a disadvantage if I am not a health professional? The answer is no, absolutely not. Um, while our entire college is focused on healthcare, we do get students in who are even in sometimes K through 12. We've had principals, superintendents, because they understand that in order to be healthy, you have to instill those factors within students and individuals from a very young age. And so those are individuals who they may not have a healthcare background, but they're coming into our program to learn about how can they instill those healthcare values into the population who they work with. And what's really exciting is when those students do come to us, they are often doing their scholarly project in middle schools or in elementary schools or high schools. And so it's a whole nother population that we get to engage with when we do have those K through 12 individuals coming to us. We're not going to teach you necessarily how to provide a curriculum to K through 12 students at the different levels, but we're going to teach you how to instill the lifetime importance of being healthy and making sure they have health practices and being a leader within that organization as well. So, higher education, academics, our public health policy, a lot of times we get individuals who are interested in going into like the Department of Health and Human Services or in population health or public health or policy types of careers. And so our program is a lot of fun simply because we have such a great diverse group of professionals who are already leaders in their own right, and they're bringing that background and that expertise into our program and applying it to whatever concepts we're learning for a particular week. So that's the kind of students we get into our program.
Thank you. Can you tell us why we have to come to campus?
Yes, so as we alluded to before, there are 2 times during the program that you get to come to our campus. The first is orientation, so it is the 2 days, the Saturday and the Sunday, right before the start of your EDD journey. And then the other time is during that population health course, which is in the summer. And we do require it. We have a policy that requires your in-person attendance for these 2 intensives. We strongly believe that this adds a great deal of value to you in your education. As we discussed earlier, the orientation is absolutely jam-packed with information designed to help you be successful from day one, but also in addition to learning about the college and the program and how to navigate your courses and what resources exist for you, we also emphasize the connections and the networking that you will be able to get from being in person with your cohort. These are folks who are going to be with you on your journey for the 24, the 36, or however many months, depending on your particular plan of study. And you will be interacting a great deal with your peers. We want you to feel connected when you go back to your hometown or somewhere else in Omaha or wherever you might live in the country. We still want you to feel very connected. And the only way to do that is to ensure that you are off to a good start with those relationships that are formed during orientation. And then during the population health intensive, the presentations are the result of your analysis of your potential site that you might be using for your doctoral scholarly project. So it's the perfect kickoff for the next 4 classes that are going to be the culmination of your EDD curriculum. The 832 intensive, you'll be presenting what needs your possible organization has that could be addressed with an evidence-based intervention that you flesh out during your doctoral scholarly project course. And you're going to get a lot of feedback on your ideas. So it's extremely valuable, and it's worth your time to come to Omaha. As I mentioned, we do have a policy. Now, we're not unreasonable. If you book a flight to come to Omaha and your flight is canceled at the last minute and you cannot book another flight to get here on time, or there's just no possible way, we are not unreasonable people. We just ask that you communicate with us to let us know the circumstances, and we will troubleshoot. We will brainstorm an alternative with you, or if you get gravely ill, or if a loved one has a health issue. We are here to be in communication with you and to help you come up with a workaround.
All right. Can you tell us how much we have to study each week?
So the amount of time that you'll put into the program per week really depends on how many credit hours you're taking, how many courses you're in at any given time. But the rule of thumb typically is, for every credit hour that you are in a course, you will spend 45 clock hours for that one credit hour. So the majority of our courses are 3 credit hours. So 45 times 3 is 135 um, clock hours that you would spend in that 10-week course. So that averages out to about 13 and a half hours per week of focusing on one particular course. Now, keep in mind that doesn't mean that for 13 hours a week you're going to be reading or working on assignments or be online. That's not what it means. One thing that you're going to be transitioning to as a doctoral student is really, it's going to change the way you think about things. And all of our assignments are very application focused. And so we're going to give you a concept, and then you need to think about it and really apply it to your own experience and your own expertise. And so much of that 13 hours is just spent thinking. When I went to a doctoral program, it was on camp, it was on ground, and I can't even tell you how much thinking time I got done in that driving commute because I had to drive over an hour each way to class. And that time was so valuable to just think about what I was learning and applying it to how I could use it within my profession and in my practice. So much of your time spent per week is actually just on that thinking and processing the information. And then, yes, eventually you will put that into a deliverable requirement of an assignment, whatever it may be, for that particular week. So about 13 hours, 13 and a half hours per week. Through all of the methods I just described is what you can expect to spend in the program.
All right.
Per
Thank you.
class. Per class.
All right. Can you tell us about support through the scholarly research process?
Yeah, so just a quick background about the scholarly research project. It's 1 year in length, and it has 4 courses that will get you through that year. You are walked through every step of that process with a faculty member. So you will start with a faculty member, and that faculty member will have approximately 4 to 5 students in the section that you're in. And you will stay with that same faculty member and that same section of peers throughout that entire year and all 4 of those scholarly project courses. So it's not a group project. You're still doing your project individually, but you're with the same peers as you all are working through the same process with your own individual respected project. So you will have that same faculty member. In fact, that faculty member works so closely with you from start to finish, conceptualizing your project idea, figuring out the design of your project, getting IRB approvals, implementation, dissemination. They're with you through all of it. Um, in addition, we do have resources available for you specific to our doctoral program, and that includes a writing coach who is available for our doctoral students for assistance with scholarly writing. As you can imagine, working on a doctoral scholarly project requires significant high levels of scholarly writing, and perhaps it's been a long time since you've had an English course. So it's good to refresh some of those ways of correct grammar, using APA 7th edition, those sorts of things. So we have tremendous resource in our doctoral writing coach. Our librarian also helps with APA and 7th edition, if that's an area that's kind of new to you, or perhaps you feel a little rusty in that area and need some additional support with ensuring your APA 7th edition is correct. And then the other resource, as mentioned previously, is we do have a statistician for our doctoral scholarly project students. And he has been with the college even since our program started. So he's very familiar with our projects and has worked with students all through since the program began. And so he is also a resource to help you with your design of your data analysis, as well as conducting the analysis itself and interpreting it. So all of those resources are in place to help you be successful in in producing a rigorous, high-level research project.
All right. So what are the student health and compliance requirements?
Well, these are very minimal. So all that we require for student health and compliance is for for a background check to be submitted, for you to pay the small fee for the background check, the small fee for our compliance account, which is where we would house your vaccination record for MMR, measles, mumps, and rubella. That is the only vaccination status that we require documentation of. And so that should be readily available in your health records. If not, you can also go have a quick titer done and send us that documentation. So these are very standard, no different than what most universities would require for student health and compliance. And it is because of those on-campus intensives that we do need to see proof of your MMR vaccination status. We are a health professions college, and so we have a lot of students and faculty who go back and forth between the college and the health system that we are an affiliate member of. So we need to be sure that anybody who is spending a weekend on our campus has that proof of vaccination. And then it is also possible, as you are carrying out your own doctoral scholarly project, that you may also be implementing at an organization where there are patients or students or vulnerable populations. And so while that is really up to you to determine whether there are any health requirements that you need to meet for that organization, at least you will know that you already have met the MMR requirement through what Methodist requires.